Strep throat. It sounds almost harmless, like a minor inconvenience. Yet, this common infection affects millions worldwide, particularly children and teenagers. It's a stark reminder that even seemingly minor ailments can disrupt our lives and have lasting consequences if ignored. This essay delves into the world of strep throat, providing you with the knowledge to identify, treat, and prevent this pervasive infection. We'll explore its causes, symptoms, and available treatment options. Importantly, we'll debunk common myths surrounding strep throat and equip you with practical tips for safeguarding yourself and your loved ones. By understanding strep throat, we can minimize its impact and ensure a healthier future for ourselves and our communities. Strep throat, despite its simple-sounding name, is a bacterial infection. It specifically targets the throat and tonsils, causing inflammation and discomfort. The culprit behind this common ailment is a bacterium known as Group A Streptococcus. This bacterium is highly contagious, spreading easily through close contact with infected individuals or contaminated surfaces. When these bacteria invade the throat, they multiply rapidly, leading to the characteristic symptoms of strep throat. Understanding the nature of this bacterial infection is crucial for effective prevention and treatment. Strep throat is not just a bad sore throat, it's a bacterial invasion that requires specific treatment to eradicate the infection and prevent complications. Recognizing the symptoms of strep throat is crucial for prompt diagnosis and treatment. While some symptoms might mimic those of a common cold or the flu, certain telltale signs can help differentiate strep throat from other respiratory illnesses. One of the most common symptoms is a sudden and severe sore throat, often described as a feeling of scratchiness or rawness. This discomfort is typically accompanied by difficulty swallowing, making it painful to eat or drink. Other common symptoms include fever, usually high and appearing suddenly, swollen lymph nodes in the neck, which may feel tender to the touch, and white patches or streaks of pus on the tonsils. There are many misconceptions surrounding strep throat, often leading to delayed diagnosis and inappropriate self-treatment. One common misconception is that strep throat always presents with a cough or runny nose, which are more characteristic of viral infections. While some individuals with strep throat may experience these symptoms, their absence doesn't rule out the possibility of a bacterial infection. Another misconception is that gargling with salt water or over-the-counter throat lozenges can cure strep throat. While these remedies can provide temporary relief from throat pain, they do not address the underlying bacterial infection. It's essential to remember that strep throat requires antibiotic treatment to eradicate the bacteria and prevent complications. Seeking answers. Diagnosis and when to see a doctor. If you suspect you or your child might have strep throat, seeking prompt medical attention is crucial. Strep throat is a bacterial infection that can cause significant discomfort and, if left untreated, may lead to more serious health issues. Early diagnosis and treatment are essential to prevent the spread of infection and reduce the risk of complications. Complications from untreated strep throat can include rheumatic fever, which can affect the heart, joints, and nervous system. A doctor can diagnose strep throat through a simple physical examination and a rapid strep test. During the physical exam, the doctor will look for signs such as redness, swelling, and white patches in the throat. This test involves swabbing the back of the throat to collect a sample, which is then analyzed for the presence of Group A Streptococcus bacteria. The rapid strep test can provide results within minutes, making it a quick and efficient diagnostic tool. If the rapid strep test is positive, confirming the diagnosis, the doctor will prescribe antibiotics to treat the infection. Antibiotics help to reduce the duration of symptoms, prevent the spread of the bacteria to others, and lower the risk of complications. Even if the rapid strep test is negative but strep throat is still suspected, the doctor may order a throat culture, a more sensitive test that takes longer to process. The throat culture involves growing the bacteria from the sample in a lab, which can take 24 to 48 hours to yield results. Winning the battle treatment options for strep throat. Once diagnosed with strep throat, the primary course of treatment is a course of antibiotics, usually penicillin or amoxicillin. These antibiotics work by killing the Streptococcus bacteria responsible for the infection, thus shortening the duration of symptoms and preventing complications. It's crucial to complete the entire course of antibiotics as prescribed, even if you start feeling better before finishing all the medication. Failure to complete the full course can lead to antibiotic resistance and increase the risk of recurrent infections. In addition to antibiotics, over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage fever and relieve throat pain. Section 7. Shielding yourself, effective prevention strategies. In this section, we will explore various methods to protect yourself and others from infections, particularly focusing on strep throat. Preventing strep throat involves adopting simple yet effective hygiene practices to minimize the risk of infection. These practices are easy to incorporate into your daily routine and can significantly reduce your chances of getting sick. One of the most crucial steps is frequent and thorough hand washing. Make sure to wash your hands with soap and water for at least 20 seconds, especially before eating, after using the restroom, and after coughing or sneezing. This simple act can eliminate many harmful germs. If soap and water are unavailable, use an alcohol-based hand sanitizer. Ensure the sanitizer contains at least 60% alcohol to be effective in killing germs. Covering your mouth and nose when coughing or sneezing is essential to prevent the spread of respiratory droplets that can transmit the bacteria. Use a tissue or your elbow to cover your mouth and nose, and dispose of the tissue immediately. Avoid close contact with individuals who are sick, especially those exhibiting symptoms of strep throat. Maintaining a safe distance can help prevent the transmission of the bacteria. Avoid sharing personal items, such as utensils, cups, and towels, which can harbor the bacteria and spread the infection. Personal hygiene is crucial in controlling the spread of strep throat and other infections. By following these strategies, you can protect yourself and contribute to a healthier community. Section 8. Triumph over strep stories of successful management. Countless individuals have successfully managed strep throat by seeking prompt medical attention and adhering to prescribed treatment plans. These stories serve as a testament to the resilience and determination of patients and their families. These stories highlight the importance of early intervention and underscore the effectiveness of antibiotics in eradicating the infection. Antibiotics, when taken as prescribed, can significantly reduce the duration and severity of symptoms, making a world of difference in the patient's recovery. Take, for example, the story of a young student who developed a severe sore throat, fever, and difficulty swallowing. His condition rapidly worsened, causing great concern for his well-being. Recognizing the symptoms of strep throat, his parents immediately took him to the doctor. Their quick response was crucial in ensuring he received the necessary medical attention without delay. A rapid strep test confirmed the diagnosis, and the doctor prescribed a course of antibiotics. This swift diagnosis and treatment plan were essential in managing the infection effectively. Within days of starting the antibiotics, the boy's symptoms began to subside, and he made a full recovery. His energy levels returned, and he was able to resume his normal activities without any lingering effects. This case demonstrates the importance of early diagnosis and treatment in preventing complications and ensuring a speedy recovery. Early intervention not only alleviates symptoms but also reduces the risk of the infection spreading to others, highlighting the broader public health benefits. Section 9. Your questions answered. Addressing common concerns. Many questions and concerns often arise regarding strep throat. One common question is whether strep throat can recur. While completing a full course of antibiotics usually eradicates the infection, some individuals may be prone to recurrent episodes, especially if they have weakened immune systems or frequent exposure to infected individuals. Another concern is the possibility of complications from strep throat. While rare, untreated strep throat can lead to complications such as scarlet fever, rheumatic fever, and kidney inflammation. It's crucial to seek medical attention if you experience persistent or worsening symptoms. Section 10. A healthier tomorrow. The importance of vigilance. Strep throat, though common and treatable, serves as a reminder of the importance of health vigilance. By understanding the causes, symptoms, and prevention strategies for strep throat, we can minimize its impact on our lives and the lives of our loved ones. Prompt medical attention, adherence to prescribed treatment, and diligent hygiene practices are crucial for preventing the spread of this contagious infection and ensuring a healthier future for all. Remember, knowledge is power when it comes to our health. By staying informed and proactive, we can effectively combat strep throat and other infectious diseases, creating a healthier tomorrow for ourselves and our communities.